Good morning, your Celebration Radio Network.
Good morning. This is Dr. Rudrani Banik calling.
Hi, Dr. Ronnie. Well, you are calling to help us understand how viruses can get into the eyes and what screen time has to do with, not only macular degeneration, but strain that it puts on our eyes, correct?
Yes, absolutely. So I guess we can talk about viruses in the eyes first because I know that's on a lot of people's minds in terms of coronavirus. So there are a couple of ways that the virus can spread through the eyes. They're not very common, but because the eyes have a mucous membrane on the surface, if you touch something, for example, if something's contaminated like a faucet or a doorknob and then touch your eyes, could potentially introduce the virus into your eyes that way. Also, the virus is in the air. It can be aerosolized, so it can get into the mucous membranes of the eyes. Again, both of these are pretty rare, but potentially they can happen. And then the third way the virus can be spread through the eyes is actually through tears. So if someone is infected, the virus particle has been found in tears of people who are infected. So potentially if they rub their eyes and touch something, they may contaminate that surface.
Wow, I was not aware of the tear thing. I was aware of the other two, but so if someone is crying and they have the coronavirus and they wipe their tears away and then they touch someone else, a loved one, say husband and wife or a son and daughter, kind of situation, they could actually spread it to them, huh?
Yes. Again, it's not very common. It's not a common means of spread, but and it's not all found in everyone who's positive. So not all people who are infected have it in their tears, but a certain proportion do. So the best practice is simply to wash your hands. If you happen to have to touch your eyes, rub your eyes. I know it's allergy season as well, so many of us do suffer from allergies, rubbing our eyes. Make sure you wash your hands if you touch your eyes or your face.
Okay. Well, that's simple practice that should be going on anyway, but definitely a great reminder for what the country and the world is going through right now with this coronavirus. Now, I know a lot of concern has been brought to me personally because of children at home so much with screen time. I have lots of friends that have children at home doing schoolwork and things, and so they're in front of the computers a lot more than normal. What do you recommend to parents that maybe are not used to having their children, well, not only home, but sitting in front of their computer screens, doing homework and playing games that's actually part of homework? I was helping my buddy's son hook up his laptop yesterday, and the school is offering game time, things that they can do to help with eye coordination and hand coordination and things like that. So there's extra time in front of the screen that's not just homework.
Yeah, absolutely. And it's a huge concern for many people, adults and children, because many of us are also working from home and connecting with friends and loved ones through screens and also watching probably more television and Netflix. So children and adults have significantly more screen time during this pandemic. And, a lot of my patients ask me, Dr. Banik, should I be wearing blue blocking glasses? Should I get a screen filter app? But there are two wonderful ways you can protect your eyes against screens and digital eye strain and blue light. And those two ways are, number one, nutrition, and number two, consider supplementation. And let me explain why this is so important. So we have natural filters inside of our eyes. So nature has wonderfully given us these filters inside of our eyes, which are pigments that are in the retina, which is the light-sensing tissue in the eye. And these pigments, they are called lutein, zeaxanthin, and mesozeaxanthin. So there are three pigments. It may sound like a mouthful. I know the scientific names are sometimes hard to pronounce and remember, but these are three essential pigments. And unfortunately, our bodies can't make these pigments, so we need to get them from external sources. The best way to do this is through nutrition, and there are specific fruits and vegetables that have these pigments in them. Specifically green leafy vegetables like spinach and kale and collard greens, also yellow and orange vegetables like bell peppers and corn, and even some spices like paprika have lutein and zeaxanthin in them. The issue is the mesozeaxanthin, which is that third pigment I was mentioning, is not readily found in foods. It's found actually in very small quantities in foods. And also, even with a really healthy diet, we just can't get enough of these pigments from food. So that's why I had mentioned before, it may be best to supplement with these three pigments. And there are many eye health supplements out there. If you go, online, or if you go to the store, you'll see probably 40 or 50 different brands. But in order to get these three, look for a specific ingredient that actually provides all of them and takes the guesswork out of it. It's very simple. It's called Lutamax 2020. And it has all three of those pigments in the right ratio that's actually in our bodies, in our retinas. So again, if you want a simple solution, you can supplement. And I know with children, it may be, even more tricky, because getting them to, first of all, eat those fruits and vegetables is difficult. But also perhaps, considering giving them a supplement, they may not be able to swallow a pill or capsule. There are great gummy forms of these supplements now available as well, which are great for kids.
Awesome. So I guess that takes the next question right out of my mouth. I was going to ask you, what supplements do you recommend for, because I know that there are a lot of things that are out there for people to consume that will actually help with the screen time. Now, the migraine side of this, a lot of people, because of the eye strain, what would you recommend for people that suffer from that, but still have to do the computer screens? Is there...
So it's a very similar solution. So people who have migraine, they tend to be more light sensitive. And so because these screens emit this blue light, which triggers light sensitivity, screens also have a flicker rate that can trigger light sensitivity. It can be very challenging for people with migraine. So in that situation, again, I would recommend, going back to the nutrition is so important to get those pigments, the supplementation. In that situation, you may want to consider specific filtering glasses that actually filter out not just blue light, but specific wavelengths that trigger migraine. And there are glasses called FL41 tinted glasses that have been clinically proven in migraine. So that would be my suggestion. There are also some great screen filter apps that actually filter out the blue light internally from the screen. So if anyone's interested, please reach out to me. I'm happy to share any of that information with your audience as well.
Okay. And how do they get in touch with you?
So my website is probably the best way to get in touch with me. It's my full name, which is RudraniBanikMD.com. But I'm also very active on social media, both on Instagram at Dr.RaniBanik and on Facebook as well. And so please follow me, join me on social media. I'm happy to answer questions. And I provide a lot of great tips about eye health and brain health on my social media account. So please reach out.
All right. Now, how do they get in touch with you for this new book that you've written?
Yeah, so my book is not out yet. It's slightly delayed because of the current situation. But if you stay connected with me, either via my website or social media, I will definitely post updates. It will ultimately be available on Amazon and through multiple websites as well. So I hope to have it out soon. And again, please reach out if you have any questions. I'm also available for telemedicine consults. Even for people who are, I'm based in New York, but even for people who are out of state, I am available. So I'm happy to answer any questions.
All right. Is there a phone number, or just reach out through the social media platform or your website?
My phone number, my office number is 646-820-2074. But also, if you connect with me through my website, you can book a telemedicine consult or just send a message. You can email me through my website as well.
Okay. Awesome. Well, thank you so much. I really appreciate your information, Dr. Rani.
Thank you so much for having me. It's been a pleasure.